I'm Bernie Black. I'm a professor of law and a professor of finance at Northwestern University. I'm mostly doing health policy. COVID hit in 2020. I'm going to study COVID like everybody else, and the question is, can I find something interesting to do that other people can't do? Israel was one of the first countries to vaccinate its population, so you can view Israel as a laboratory for the world on what's the effect of a third dose. How many more people died because they didn't get boosters when they could have gotten boosters if the US had moved faster? And our answer turns out to be 29,000. A lot of avoidable COVID deaths. Now that's if we had rolled out boosters as fast as Israel. We couldn't have done that. But we could have moved faster than we did, and we still would have saved an awful lot of lives. Our estimate there, if we moved 8 weeks later, but moved with Israel's speed, is 21,000. What we saw was a lot of pushback, partly from within the FDA, which had scientists who were used to doing things their own slow, methodical way. And their view, as best I could tell, seems to be, we don't trust the Israeli data, we want to see our own data. Well, but you're in the middle of a pandemic, and your own data doesn't exist because the U.S. isn't as good as collecting it, and the U.S. hasn't experienced waning yet, for both reasons. And what happened in the U.S. was, even when we authorized boosters, the take-up was a lot slower because the public health messaging was just not crisp and clear. Other countries did move faster. A bunch of European countries authorized boosters on September 1st. We authorized boosters only for people over 65 several weeks later. And I think there's a lesson there for how to make the trade-off between speed and scientific certainty when you're in an emergency situation.